going to start by telling you a little bit about celiac disease. Celiac disease is sometimes called celiac sprue, non-tropical sprue, or gluten-sensitive enteropathy. It's a hereditary disorder that is triggered by the ingestion of gluten, and it's an autoimmune condition. So there really needs to be three things present for celiac disease to develop. You have to have the genes that predispose you to it. You have to be eating gluten, and then there seems to be some sort of environmental trigger that makes celiac disease come to light. And at this point in time, we're really not sure what that is. It often seems to be a medical illness. Celiac disease is a multi-system and multi-symptom disorder. And what happens is when people eat gluten, the lining of their intestines become damaged and inflamed, and they're no longer able to absorb nutrients as they once did. But although celiac disease is a disorder that affects the GI tract, it really has effects far outside the GI tract, and we're going to talk about that. Celiac disease is actually quite common in the United States. It's the most common autoimmune disorder. It affects about 1% of the population, or 1 in about 133 Americans. So if you have a relative who has celiac disease, if you have a parent or a sibling with celiac disease, you have a 5% chance of also having celiac disease. If you have a cousin or a more distant relative that has celiac disease, you have about a 3% chance of developing celiac disease yourself. So what is gluten? A lot of people have heard of gluten, but maybe aren't sure what it is. Gluten is the protein that's found in certain grains, and this is a list of the grains that contain gluten. Wheat is the big one. Wheat probably provides 90% of the gluten in the American diet. It's very, very prevalent in the foods that Americans eat. And then we also have rye, barley. Oats themselves are actually gluten-free, but in the United States, they're widely contaminated with the other gluten-containing grains. So oats really are not considered safe for people with celiac disease. And then there's some lesser-known grains that also contain gluten, and those are spelt, triticale, and kamut. Now, just in case you think it might be easy to avoid gluten, I want to show you a list of some places that you find gluten that you just might not have expected. So here, you can find gluten in many, many places, and this is a list of things that are maybe not so obvious. Of course, we have gluten in the very obvious places like bread and crackers and pasta. But you might not think that you'd find gluten in things like licorice candy, taco and chili seasoning packets. It's in imitation seafood, imitation bacon bits that you might find on a salad bar in a restaurant, seasoned chili beans in a can. Many canned soups contain gluten. Some of the seasoned Parmesan cheeses contain gluten. Soy sauce and anything made with soy sauce, so that's a lot of marinades and Chinese foods and other Asian foods. Barbecue potato chips sometimes contain gluten. Even herbal teas, occasionally soy beverages like soy milk. And then some non-food sources. Play-Doh is made with wheat, so for children who have celiac disease, playing with Play-Doh can be an issue because they get that Play-Doh under their fingernails, and then they can't, they might touch their mouths and get the gluten in their mouths. Prescription drugs and over-the-counter medications occasionally contain gluten. Even lipstick can contain gluten. And then another source of gluten that I sometimes talk about with my clients is if you kiss someone who's been eating something with gluten in it, you can actually be exposed. So there's a lot of ways to get gluten that you might not expect. So how does celiac disease present itself? There's actually three what we call clinical subtypes of celiac disease. And we have a classic presentation, an atypical presentation, and then a silent or asymptomatic presentation. The classic presentation is the one that you might have heard about in terms of celiac disease. And the classic presentation in adults is basically GI symptoms, chronic diarrhea, pale, foul-smelling stools, abdominal distension and pain, fatigue and weakness, and of course malabsorption of nutrients, because that's really what happens in celiac disease is the lining of the intestines becomes inflamed and you're no longer able to absorb nutrients. Children also can present with this GI presentation. The diarrhea is very common. Failure to grow, failure to thrive. Children will often have weight loss, but some children will have constipation. Some will have gas and bloating. Some children will throw up. And you tend to see these fairly classic symptoms in young children under the age of 3. As children become older, they tend to have more atypical symptoms. 8. So the atypical symptoms are symptoms that really don't appear to be associated with the gastrointestinal tract. So you have fewer GI symptoms. You can have anemia because of iron malabsorption and other nutrient problems with nutrient absorption, such as folate or B12. You can have, in adults, you can have osteoporosis, and even in children, you can have low bone density. You can have problems with fertility. You can have neurological problems, tingling of the extremities, hands and feet, balance issues. Some people will have a cognitive decline, an inability to concentrate, an inability to remember things. And then you can sometimes see some other GI issues with patients, such as increased pancreatic enzymes, increased liver function tests. You can have IBS-type symptoms where you have gas and bloating. Some patients have bone pain, joint pain, muscle pain, and some people even suffer depression. In fact, I found with my clients that's fairly common that people often will feel depressed before they're diagnosed with celiac disease. In children, the atypical presentation, and this again is in older children, is a little bit different. You tend to have children who fail to grow, so you have short stature. You have iron deficiency anemia, again, low bone density, irritability, problems with the dental enamel forming, and this would be caught by a dentist. You can have delayed puberty, delayed motor development in younger children. So, for instance, if your child doesn't learn to walk when you think they should, that could be a symptom. You can see a sudden decline in academic performance in children. You sometimes see seizures and other neurological symptoms as well. And so then we actually have an asymptomatic presentation of celiac disease, and this is actually quite common. The literature suggests that about half of the people who have celiac disease are actually have very, very few or no obvious symptoms. And I found that to be true with the clients that I see when I educate them about how to follow a gluten-free diet. So this is a fairly common presentation. Unfortunately, if you don't know to look for it, these folks often don't find out they have celiac disease for a very long time. So there's a lack of classic or atypical symptoms, but these folks still have villus atrophy or that inflammation in their GI tract. And when they're tested, they have positive blood tests. We have some other disorders that are also associated with celiac disease. Because it's a genetic disorder, there are some conditions that are associated by genetics with celiac disease. The most common are type 1 diabetes, and that's the juvenile diabetes. So about somewhere between 3 and 8% of people with type 1 diabetes also have celiac disease. People who have autoimmune thyroid disorders like Hashimoto's or Graves' disease have a much higher prevalence of celiac disease. We have Sjogren's syndrome, which is an inability to produce saliva and tears, so very dry mucous membranes, and there's a high prevalence of celiac disease in that disorder. You also see celiac disease in autoimmune hepatitis and another autoimmune liver disorder called biliary cirrhosis. There also seems to be an association with the inflammatory bowel disorders like Crohn's and ulcerative colitis. And then there's some genetic disorders where you also see celiac disease, and those are Turner syndrome, Down syndrome, and Williams syndrome. And then in addition, there's a disorder called selective IgA deficiency, and there's a very high prevalence of celiac disease in those patients. Unfortunately, a lot of people who have IgA deficiency don't know that they have it, but it's associated with people who have kind of chronic problems with their lungs and chronic problems with their GI tract, because IgA is what mediates immunity in the GI tract and the lungs. The last thing that I want to talk with you about in terms of disorders that are associated with celiac disease is a condition called dermatitis herpetiformis. And this is actually the skin manifestation of celiac disease. This occurs in about between 5 and 20% of patients with celiac disease. It's an extremely itchy, blistering rash that appears bilaterally on the extremities, knees, elbows, the scalp, and the neck. And really the hallmark is that it's bilateral. It is maddeningly itchy, and nothing really seems to work to make it better. Topical medications, steroids, they just don't seem to really do anything for it. And this is a condition that would be diagnosed by a dermatologist, and virtually 100% of people who have dermatitis also have celiac disease, but they tend to have less damage in their gut. So when they look at the intestines, you don't see as much damage, but this is really the manifestation of gluten intolerance in the skin. And a few other reasons to suspect celiac disease. I already talked about some of these. Anemia, neurological problems, and there's some speculation that there may be a connection between autism and celiac disease, or possibly gluten intolerance, and I'm going to explain gluten intolerance in a minute because it's a little bit different than celiac disease. And then you also have some psychiatric disorders that may be associated with celiac disease. I mentioned depression already. There's some evidence that ADHD in children may be associated with gluten. I mentioned cognitive decline, and then there seems to be an association between schizophrenia and celiac disease as well. You also see certain types of cancer in people who have untreated celiac disease. You see bone loss or osteoporosis, and I mentioned infertility and dental enamel defects earlier. So those are all things that can happen when you have untreated and undiagnosed celiac disease. So now I want to talk a little bit about gluten intolerance. I've been really focused on celiac disease so far because we really have the most research. Most research has been done in celiac disease, and so we know a lot more about it. In the last couple of years, there has been more research done on gluten intolerance. And what we found is that gluten intolerance is a disorder that is related to celiac disease, but it's different. It actually affects more people than celiac disease does. About 6% of Americans, or about 18 million people, and that's a lot of people. You have many of the same symptoms. You have GI distress and gas and bloating that are caused by poor digestion of gluten proteins. A lot of people have diarrhea. And what is seeming to happen is that the gut, when it's exposed to gluten, becomes permeable. And this leads to some symptoms outside the GI tract, like headaches and fatigue. The symptoms of gluten intolerance, again, are very similar to celiac disease. And there's a wide range. You can have some people with just kind of mildly bothersome symptoms, and you can have some people with gluten intolerance that are really debilitated by this, and are sometimes even sicker than people who have celiac disease. A key difference is there does not seem to be nutrient malabsorption, so people don't tend to have anemia or problems with their bones related to gluten intolerance. There are no blood tests available at this time to test for gluten intolerance, so the way that it's diagnosed at this point is by ruling out celiac disease, by having tests for celiac disease to make sure that that's not the issue, and to be sure there aren't other underlying gastrointestinal problems. But then, once that's ruled out, what we do is we do a trial of a gluten-free diet to see if patients' symptoms improve. And that's really the only way at this point in time to test for gluten intolerance. I think in the next 5 years or so, there will be a test that is developed for gluten intolerance, though, because there's a lot of research going on in that field. Diagnosing celiac disease. The average time in the United States to get a diagnosis of celiac disease is 9 years. And that sounds like a long time, and it is. When I started working with celiac patients, it was 11 years. So we're actually getting better, but still, many physicians don't recognize celiac disease, and they don't recognize all the symptoms. And by now you probably realize there's such a wide variety of symptoms, and so many of the symptoms could be related to other disorders that this can be sort of a tricky thing to diagnose. So there's really 3 avenues of diagnosis. We have blood tests, we have intestinal biopsies, and we have genetic testing. And I just want to point out that if in order for the tests, the blood tests and the intestinal biopsies to be valid for celiac disease, you really have to be consuming gluten. So we don't recommend to people that you go out and just try a gluten-free diet on your own if you think you have celiac disease, because once you're on that gluten-free diet, if you want to get tested for celiac disease, it can be tricky to get an appropriate diagnosis. These are some common tests for celiac disease, and I'm not going to go all through these in detail. Just want to point to the first test, which has a big long name. It's an IgA, anti-tissue transglutaminase antibody, and it's abbreviated TTG. And that's really the main test that your physician would need to do if you wanted to have a blood test for celiac disease. It's really considered a screening test, and it's not completely diagnostic in itself, but it would give you a good indication of whether you have celiac disease and needed to have further testing. So the gold standard for diagnosis of celiac disease is having a biopsy of your small intestine. And what they do is they insert an endoscope through the mouth and into the small intestine, and they take several tissue samples and they examine those under a microscope, and then they can really see what's going on at the level that's not visible to the naked eye, because you really can't see celiac disease necessarily when you go down and take these biopsies. And some people can have negative blood tests and still, once they do these tests, will have celiac disease and very apparent celiac disease when they look at the slide. That just shows you what your intestines look like. In the small intestine you have thousands of kind of hair-like projections called villi that allow you to absorb nutrients. And that first picture on the left shows you the normal villi, and you see how it's standing up nice and straight. And then as you progress towards the right, you can see that the villi become compromised and they become flattened, and eventually, in that very last picture, you have basically no ability to absorb nutrients. So that's really what's happening in celiac disease. You have basically inflammation coming up from the lining of your intestines that causes those villi basically to disappear. And here's a couple of nice pictures for you. That first picture is the normal small intestine, or the duodenum. And you can see there's some nice ridges, and it looks healthy. And then if you look at that lower picture, you see how those duodenal folds or ridges are disappearing. And that's what you see in more advanced cases of celiac disease. And then here's another picture that just shows you some of the things that a gastrointestinal specialist would be looking for when they go down there with their little tubes and lights and look at your small intestine. Again, that's kind of what the doctors are looking for. Okay, slide 21. A lot of people really want to skip that biopsy because they are afraid to have it, or it's expensive, or their insurance won't cover it. And those are pretty compelling reasons not to have one, but I just want to remind you of some good reasons to have a biopsy to confirm a diagnosis of celiac disease. Once you start on a gluten-free diet, if indeed you have celiac disease or even gluten intolerance, it's often hard to go back. And some people, the longer that you're on a gluten-free diet, the more sensitive you become to gluten. So if you're on a gluten-free diet for 6 months and then you're feeling great, but you decide you really want to get that definitive diagnosis, you're going to have to go back and eat gluten for between 1 and 3 months. And many people find they cannot tolerate that. But because the symptoms of celiac disease and gluten intolerance are so different, just because you don't tolerate eating gluten again does not necessarily mean you have celiac disease. You might have gluten intolerance, and they're kind of two different things that require different medical follow-up. If you want to participate in any kind of clinical trials for celiac disease, you really have to have biopsy-proven disease. That's what they're looking for. And also, if you're going to have tests later on for celiac disease, your insurance probably won't cover them unless you have a diagnosis. So for example, if you wanted to have tests to look at your iron levels related to your celiac disease or a bone density related to your celiac disease, if you don't have a true diagnosis, it's going to be hard to get your insurance to cover those things. And then another good reason to get that initial biopsy is because some people don't recover right away. And in fact, the older you are when you're diagnosed, the longer it takes to recover. So if you're diagnosed over the age of 60, it can take you 3 years to recover. But if you don't recover in a reasonable amount of time, your doctor's going to want to go and look and see what's going on. And if you don't have that initial biopsy for comparison, then it's really hard to know if you've gotten better or not. So it's good to have that baseline biopsy for comparison purposes. And then and then the last thing I want to talk about in terms of diagnosing celiac disease is genetic testing. Because this is a genetic disorder, you can have genetic testing done. It's fairly expensive, but in cases where your blood work or your biopsies are equivocal or not necessarily, it was hard to tell whether you actually had celiac disease, genetic testing can be important. Also, for adults who have celiac disease who want to know if their children are susceptible, genetic testing is an option. But genetic testing by itself can't be used to diagnose celiac disease. It can only be used to rule it out. I just want to talk about how it still in America is difficult for people with celiac disease and gluten intolerance to find safe foods. At this point, there is no federal regulation defining the use of gluten-free on food labels. So we have manufacturers that use the term gluten-free on their food labels, but there's really nothing that regulates that at this point. So a manufacturer who says their food is gluten-free doesn't necessarily have to prove it. And so sometimes you have issues with cross-contamination in gluten-free foods. We do have a law called the Food Allergen Labeling and Consumer Protection Act, and that requires the clear disclosure of the top 8 allergens in food, and one of those is wheat. So that's really good for people who have celiac disease. On most packaged foods, wheat has to be clearly disclosed, but that does not address cross-contamination. And in many factory settings, there are not standards in place to prevent the contamination of a gluten-free food with wheat or gluten from a gluten-containing food. So just for example, take potato chips. Potato chips would seem to be gluten-free, but if they're produced in a facility where they're making pretzels then all of a sudden you may have some issues where you have cross-contamination between the pretzels and the potato chips. And it's difficult to know whether those potato chips are indeed gluten-free. So there's just a lot of issues regarding cross-contamination that are really concerning for people who have celiac disease. Because when you have either celiac disease or gluten intolerance, just a tiny little bit of gluten, the size of a grain of sand, can make you very, very sick for days. So it's a real serious concern for people who have celiac disease. So it's really important that we have safe gluten-free choices. And there are a couple of organizations in the United States that certify foods as gluten-free, and they provide an extra level of assurance to consumers who want to be sure that their food is actually gluten-free. And you can see at the bottom of this slide we have the certified gluten-free logo, which is a program of the Gluten Intolerance Group of North America, and then we have the circle with the check mark in it, and that is the certification mark of the National Foundation for Celiac Awareness. So those are things that you can look for on packaging to be assured that your food is really safe and that it's been tested for gluten contamination. And that just brings me to the need for having safe gluten-free bread, because if you've ever eaten gluten-free foods, you'll know that it's hard to find a good loaf of gluten-free bread. Foods are getting better and better in terms of gluten-free options, but gluten-free food does taste a little different than regular food. And so, what I find is that most people say that they miss bread the most. And so it's a really wonderful service that my gluten-free bread company is going to be based here in Hendersonville and provide an excellent tasting bread that will be available to our community of people who have celiac disease and gluten intolerance. It's my understanding that they are going to seek gluten-free certification so that the public is assured that the bread is actually gluten-free and has no cross-contamination. So, this is a very exciting time, and I'm really happy to support the bakery, and can't wait to see those first loaves of bread come out of production. So thank you for listening to this presentation.